Hi, everyone, and welcome to another episode that features an article that we published in our magazine. This time around, it is featuring Kristiyana Kaneva and her article on her journey of humility, courage, and mentorship in healthcare. So I'm going to jump right into it. Dr. Kaneva is here with me. Welcome, first of all. And secondly, can you tell the audience about yourself a bit more?
Yes, thank you so much, Dana, for inviting me to your podcast. My name is Kristiyana Kaneva. Like you said, I'm a pediatric oncologist by training, and I've been working in the healthcare industry outside of clinical medicine for the past 5 years. I was at a company called Tempest AI until recently. It's a data and diagnostic company that focuses on molecular diagnostics for patients with cancer. And I worked on developing new diagnostics for patients with cancer, and recently made the transition to the pharmaceutical industry where I'm working on clinical development of oncology drugs.
Wonderful. Congratulations, first of all. Uh,
Thank you.
we featured your interview specifically about leadership, given that we recently finished a Leadership for Women in Healthcare conference, and we have another one coming next year. So a lot of these questions are going to focus around leadership. The first being that knowing that you recently transitioned from Tempest to AbbVie, what inspired this move for you, and how did you know that it was the right time for a change?
Yeah, great question. So it was not an easy decision. It was one that took a lot of thought and time to make. But I felt like I wanted to learn more about drug development, and it felt like the time was now or never in terms of my overall career trajectory. And I had that curiosity and desire to build more foundation in terms of my skill set, diversify my skill set. I feel very comfortable in the molecular diagnostic space, but biomarkers and diagnostics are great, but not very meaningful if you don't have a drug to go along with those in order to treat a patient with cancer. So it was, again, not an easy decision since it was a big change from what I was used to and my workflow, but I've been happy so far with the transition.
Wonderful. Okay. So you've taken on the role of a medical director in the oncology early development section of AbbVie. What does a typical day look like for you in this new position, and how are you planning to leave your mark?
Yeah, great question. So a typical day, I'm still trying to figure out since I've been there for just over a month. But typically, I work with a lot of really bright individuals on my immediate team as well in a multidisciplinary setting with other teams that are a part of early oncology drug development. And I have a hybrid role, so a couple of days I'm at home on Mondays and Fridays, and this is why I'm taking this interview from home. And the rest of the time I'm in the office. And how do I plan to leave my mark? I plan to work hard and make a meaningful contribution to AbbVie's mission and ultimately to the field of oncology.
Thank you for that. You mentioned being promoted twice at Tempest. What do you think contributed most to your growth and recognition there, especially in a rapidly evolving biotech environment?
Yeah, I think what contributed to my two promotions at Tempest over the course of 5 years was the fact that I worked hard, but also made an effort to work well with others. Really tried to be humble and appreciate the contribution that everyone had to the products that we were working on developing. I think that's so important in order to succeed in the biotech industry and health tech and I think pharma as well, to work well with others and remain humble.
Thank you for that. The next question is going to be a bit more non-clinical on it in its basis, and knowing that we recently through a non-clinical conference, this may interest those that attended there, is that for clinicians considering a move into pharma, what advice would you give, especially to those who might not know where to start or are hesitant to step away from direct patient care?
Yeah, I would give the advice to network, to reach out perhaps to colleagues that have made the transition and seek feedback from them. Also, try to really get at the heart of what they enjoy doing and then see if that's something that they want to bring into industry. A lot of the skills that we develop as clinicians are very much translatable to industry. And so it's just a matter of what niche one would want to focus on and how they would like to spend their time.
Thank you for that. Okay, you're passionate about mentoring others. What's your approach to empowering future healthcare leaders, and how do you balance mentorship with your own career development?
Yeah, so I truly care about the career development of others, especially the people that I mentor, whether it's my direct reports or other mentees that I've acquired along the way. And my approach has always been to see what is unique about those individuals and inspire them to develop their potential further. A lot of times, I think we don't fully realize what our strengths are, and working with someone who can recognize those and nurture them can really help push us into the right direction.
Wonderful answer. In your experience, what's one common leadership mistake in healthcare, and how can aspiring leaders like those that are listening to this avoid it?
Yeah, I think one common leadership mistake is, especially if you are new to a role and or perhaps new to an organization, is to come and think that you need to make too many changes or have an input on everything. And from my observation of some of the strongest leaders that I have observed moving into the space has been the ability to step back and listen and see what things work well, and only focus on things that need improvement, not again not have that tendency to feel that things necessarily need to be changed, but really hone in on areas that need attention, and then do that with grace and by leveraging the input of the whole team rather than trying to make decision as a singular leader, really working with everyone together to achieve the best solution to perhaps some of the problems that may exist in an organization.
Thank you. Your story includes powerful mentorship moments from high school to fellowship to pharma. How have those relationships shaped the leader that you are today?
Yeah, I think my experience with my mentors has been instrumental to who I am today as an employee and as a leader. I've have had the opportunity or blessing and perhaps some good luck to have some amazing leaders along the way. From early days, like you mentioned in high school, I had a teacher who felt that I could be successful in the future, despite the fact that I didn't speak English at the time. And really encouraged me to apply to Illinois Wesleyan, where I went to college and majored in biology, that I think really was sort of a stepping stone to my career as a clinician and now a professional in the pharmaceutical industry. And then beyond that, I had other great mentors along the way. Dr. Jacqueline Beagle was one of my mentors when I was a fellow at Children's Hospital Los Angeles. She's a pioneer of precision oncology in the pediatric oncology space and pediatric brain tumors in particular, and really got me interested in this space. And then at Tempest, I had some amazing mentors as well. Dr. Kim Blackwell, who was the chief medical officer at the time, she's a professor of medicine and an amazing breast oncologist. And I learned a lot about leadership from her and the ability to make your mark and stand strong. And then Helen Mary was my most recent mentor at Tempest as well. And she's a GI oncologist who really inspired me as a leader as well and made sure that I had opportunities to shine and brought me into the right discussions, made sure I had a seat at the table. And so I've been, again, very fortunate to have had those mentors in my life.
Wonderful. It almost sometimes reminds me like you're being handed an Oscar and you've got to like off the top of your head, just think of the people that have
Right.
along the way. So thank you for sharing that. You've moved from a team leadership role at a smaller company to being an individual contributor in a larger pharma environment. What leadership skills are you leaning on most during a transition of this kind?
Yeah, great question. So it is a big change from the perspective of being able to delegate tasks and work with a full team to really stepping back and focusing on my skills as an individual contributor. But I do think, like you said, some of the skills, or if not all of the skills that I've developed and grown at Tempest, I'll be able to use in my current role because leadership takes on many different shapes and forms. And it's not necessarily just leading a team, but guiding relationships between people, making sure that the right decisions are being made with every step of the way. I may have a smaller input in decision making now than I did in the past, but I think that's still valuable, and the approach to any conversations or decisions that need to be made, I think having that experience will continue to be valuable.
Thank you. And last question. If you had to create a personal leadership mantra for this season of your career, what would it be? And why does it resonate with you right now?
Um, Leadership mantra would be to realize that the path to success is non-linear, and building a career can change over time may mean stepping from down from an executive medical director to a medical director, but with the intent to build new skills and invest in that skill diversification, which I think I'm confident in, it will only help me in my future career growth. So yeah, and I would say the non-linear career path would be my mantra for this current period.
Thank you so much. I'm going to wrap it up just because you gave such a great interview. Is there anything else left to leave our audience with before we stop the podcast recording?
No, I don't think so, but thank you so much for the opportunity, and I wish you a great day.
Thank you so much. And likewise, thank you so much for hopping on with us.
Thank you.